I think we'll kick off because we've just over 100 participants now. So really happy to welcome everyone to the Council of Deans of Health Equity Month event on creating inclusive learning environments, looking at reasonable adjustments in healthcare education. I'm James Hallwood. I'm the Director of Policy and External Affairs at the Council of Deans of Health, and I'll be facilitating this. And I'm really delighted that we've got a great panel joining me today to look at these from their own experiences, and then also to interact with you and think about your experiences as members. We've got Raluca Oaten, Research and Policy Fellow at the Florence Nightingale Foundation. We have Adrian Barrodale, Strategic Lead for Equality, Diversity and Inclusion at the HCPC, the Health and Care Professions Council. And we have Georgia Vine, Occupational Therapist, Graduate Teaching Assistant at the University of Huddersfield, and founding member of Able OT UK. So really glad to have everyone here for this session on reasonable adjustments. And I suppose just as we kick things off, really conscious, having visited and spoken to so many members, that perhaps I shouldn't be surprised at the turnout for today's event, because I know that this is an area which really interests members. And I think, if we're honest, sometimes causes challenges for members to fully understand what adjustments they can offer, what they should offer. Of course, the other question of sometimes what is and isn't reasonable, and the challenges that we know that members get there. So I know that members will engage this in a constructive and sensitive manner, but please do put your questions in the Q&A box. And like I said, we can look to get those answered. And before we even get into this, I know that this won't be the last event that we have on this, because I know that this is an area of huge interest to our members and our partners. So I know that we will be coming back. So please don't feel that this is a one-shot chance for us to discuss this. We will be coming back to this topic and areas like that. So I thought what we'll do is quickly go to the panel and look at what they have to say on this. So we've got a few questions that I'll then be asking and looking for some answers. And then, like I said, throughout the event, if you go to the Q&A box, which is just the third box from the bottom on the right-hand side, then if you pop questions in there, then obviously I can get them asked a little bit later on, and I'll hopefully collate them if it looks like there are similar themes arising, but you can upvote, as I said, as well. So without further ado, I thought we'll go over to Raluca, who's going to kick things off.
Brilliant. Raluca. Thank you very much, James. I think I'll start by introducing myself and a bit of Florence Nightingale for those of you who don't know. So as James said, my name is Raluca. I work for Florence Nightingale Foundation in the Policy and Influence team. For those of you who've heard of Florence Nightingale, often it's because of our leadership courses and scholarship programs that we offer. But as we normally say, when we have a community of leaders, you have got quite strong voices and leaders within that community that want to make changes. And so this is how we launched the think tank side of the Florence Nightingale Foundation. And this reflects the experiences of our members who are both NHS organisations, higher education institutions, as well as social care and private entities. And so for this particular conversation, I come from two pieces of work that we have done. One of them was submitted last year. It was launched last year. And it was a piece of work that we have been commissioned by the NMC, the Nursing and Midwife Council, to work with Nuffield Trust to look at what makes a great learning environment. And the other one was a sort of a spin-off of this, and it was a very, very engaging session. And I know some of the colleagues from the Council of Deans joined, that we did on our Students' Day with students and early career around reasonable adjustment. And just to give you a bit of a sort of background, and I guess that will inform my answers to the questions that James will be posing very, very shortly. When we started the work on the learning environment, was all about what makes a great learning environment. So our topic guides that guided the interviews and the focus group and all of the engagement that we did was about tell us what it makes a great one. But when you ask that question, the challenges are the first that come through. And we have heard over and over again the challenges around reasonable adjustments, a lot from the students and the sort of early careers perspectives, but also echoed within the policy focus groups that we have done. So I guess my answers will be focused on that and what we have heard, but also what we've heard from the students and their providers in terms of what actually works within environments. So hopefully that will bring some context and also some papers. I will put in the chat the link to the report should you want to read it in more detail. I don't know whether that's helpful, James.
That would be great. Thanks, Raluca. Yeah, if you want to pop that through there, we'll make sure that gets to people. And for people watching this back, we'll make sure that all the links to reports are shared as well, so that you have that.
Hi everyone, so I'm Adrian Barradell. I am the Strategic Lead for Equality, Diversity, Inclusion at the Health and Care Professions Council. I mean, first of all, thank you very much for inviting us along to participate in this. I'm really looking forward to hearing and discussing some of the challenges around reasonable adjustments and some of the opportunities we've got really to support disabled learners in their careers and their prospective careers. I suppose some things at HCPC, we set the standards for education and training providers, and I'll have kind of more to say on that a little bit later on, and some links to share, because we've got a live consultation right now on our revised proposed revisions to our updated standards for education and training, but also the standards obviously for practice as well. And really, I think, in the role that we have, we're really keen to understand what it is more that we can do. And one of the questions that James is going to pose later is specifically around how we can kind of work with others in the sector to improve the experience, drive consistency, and understand what those challenges are, and perhaps play that back through our standards work, but also the support and guidance. We have some guidance that's available on our website. I'd be the first to admit that it's at risk of becoming out of date, and it's certainly due for revision, which is something we're keen to explore over the coming months and years. And when that does happen, we'd really be looking for a huge amount of input from external partners as well. So I guess what I wanted to do today is flag that there's real opportunity for people to support the work of HCPC and help us and keep us on the right path, and help shape what we put into our standards and the guidance that perhaps is that we can support in the future. Otherwise, yeah, I'm really looking forward to participating, so thank you very much.
Great, thanks so much, Adrian. And Georgia, I know we're going to go over to you as well. So just to say to participants who joined us that Georgia is going to be using some software to help transcribe called Voice It. So we're going to share the screen, and it might be a bit small. So what you can do is, if you just go on your mouse pad and pinch the screen, you can zoom in and you can kind of get that to the right size that works best for you. But Georgia, over to you. I think we've not got your audio, so we can read it definitely.
Working now.
Perfect, got you.
I was too busy concentrating on sharing the screen. Hi everyone, I hope I did working. I'm Georgia Barton. I'm here on behalf of representing the Royal Court Worker with some therapy today, and I kind of come at this from a that being proactive and the perspective of someone that working currently in education there. I'm going to be talking about points in particular because they're kind of points that I've been sort of buried to the student. So I've been reflecting on that a lot and thinking about that from my role now as an educator, and how it's hard for students to get the access to the support that they need, especially they've not been in any of these environments before. So I'm really looking forward to being on the panel today, and thank you for inviting me.
So much, Georgia. Right, so we were going to start with our first speaker, so Raluca, and based on your experience and the research that you've been doing, just to ask about what students' experiences are of reasonable adjustments in practice learning environments.
That's a very timely question, isn't it? It is varied. I think that will probably describe it in one word. They found the experience varied. They found that it really depends on whether the supervisor, so that's your practice environment supervisor, whether they feel confident. Sometimes there is they found a conversation around the fact that reasonable adjustments that are protected under the Equality Act are seen as special treatments. So they're not quite sure how to proceed. And when you really, if you look at the bigger picture, when you combine that with, your rota pressures, your limited time in your stretched teams that we know, especially, but not only the NHS and social care are experiencing, those adjustments often are seen, or students perceive them as being seen as an extra burden rather than a core part of their safe education. And a lot of the students told us that sometimes they feel judged, or they have been told, and they said that quite loudly in the reasonable adjustment webinar that we did. They were told that you knew about this when you applied to do your nursing. Why are you coming up with this request now? And so they felt judged. They felt that actually they weren't open, and they didn't have a psychological safe environment to be able to raise that. And often those students from disabled, mature and minoritized backgrounds experienced greater inconsistencies, and those disadvantages just mounted up for them. So a lot of the conversations were around that not being standardized. And the other very important bit that came through, and when we did the reasonable adjustment, I think it's worth saying we did that for the NMC, because one of the key lines of inquiries following the report we submitted in December was to look at reasonable adjustments. So they are currently still looking within that as a on its own a key line of inquiry, and we haven't yet heard them reporting on it. So we'll be looking at timelines for that. But what we have heard is that there is a breakdown between, often, not always, but often there is a breakdown between your higher education institutions where reasonable adjustment plans are put in place, and then your practice learning environment, who don't receive those for a variety of reasons. And it's not from malice, it's from GDPR conversations, whether or not they can. But what that meant for the students, and as I said, they were quite open to share their experiences, they felt they had to re-explain themselves every time. And that burden of having to do so and feeling under the pressure of doing so, and not really knowing whether that particular practice environment will be open to it, felt like an incredible burden to them as students. And so that disconnect between how can we actually work closer with the higher education institutions and the practice learning environment to be able to use perhaps the same templates, perhaps the same sort of documents, and to be able to share the information, obviously with the right permissions in place around the needs. And lastly, we found that within practice environments, reasonable adjustments often come through when there is a crisis. So there isn't that proactive lens often. Again, we have heard some really, really great examples where that proactive lens was there, but often that doesn't exist. So it's when the student's very close to not being signed off for that particular placement, or a crisis is happening, is then those reasonable adjustments were coming through. So quite an impact on those individuals per se, for sure. So that proactive conversations was something that was really desired as a solution as well, but also a mandatory reasonable adjustments training. And I know it's so sort of varied in terms of what counts as a reasonable adjustment, but as a general for those supervisors and assessors, it was seen as very important.
Really good. And I suppose I know that lots of members will probably feel that that's part of the challenge, which is speaking about such a vast array of different scenarios, and the context can differ so much as well, that I think very often members aren't entirely sure about what to do, what the right thing is, and indeed what the wrong thing is as well. And it's that balance, I suppose, between making sure that reasonable adjustments are in place, but also ensuring that people are able to fulfill the requirements of a profession as well. And so that it's always going to be a really crucial balance to get right. And I know that members will have that in mind as they kind of watch this. I suppose a question for all of you, but maybe we could kind of kick off with you, Adrian, is just perhaps in your experience what some of those common challenges are that come up, and if there is kind of if there are resistance or areas of clarity that often come up to you when it comes to implementing reasonable adjustments, especially in clinical settings, and any thoughts you have on how they could be overcome.
Yeah, thanks, James. I mean, I think Raluca's really probably articulated that the importance of consistency in sharing information. And I'll come on to a second point in a minute, but that I think from a regulatory perspective, the thing we're really keen to see is as much consistency in approach as is possible. We totally recognize that won't guarantee consistency of outcome, and that's pretty much impossible to guarantee because it will differ enormously across context and settings. But a consistent approach where the learner can be sure about the nature of the information that's required to be shared, who that should be shared with, and how it's going to be considered, I think is probably a really supportive approach. And that needs to go hand in hand with an organisation, HIs in particular, having a really clear understanding of what their responsibilities are. And the extent to which they're responsible for example, supporting learners to access those reasonable adjustments in practice settings, and the function of having really open, honest conversations, and in trusting environments. And that's not a quick win. That's something that has to be earned. But the opportunity for people to share that kind of information and know that it's going to be used to design support rather than trying to filter them out. And I think that's the approach that we'd like to see that, and then we want to be involved in as well. I think there was another point there, which is, and I will probably do this a few times today. We are at HCPC, we're currently updating our standards of education and training, and there's a public consultation, and I'll share the details of that at the moment. But we do talk about HI's education providers' responsibilities around reasonable adjustments, and having a really clear picture about the nature of the reasonable adjustments we're expected to make. So being clear that the reasonable adjustments are to support the education and the educational outcomes, and that the conversations aren't about, or the decisions, I should say, aren't about an imagined future career and an imagined future workplace. The conversation, there should absolutely be an open and honest conversation with the disabled learner about, what their career aspirations are, what their objectives are, what they would like to do with that. But to put it bluntly, to refuse to make a reasonable adjustment because it may not be available at an imagined workplace in the future, which is unfortunately some of the experience we know that disabled learners have had is not appropriate, and it's something we're kind of keen to kind of make sure people do understand what those experiences are. Oh, you're mute, James.
I'm sorry, classic. Thanks, Adrian. Georgia, I wonder whether you had any thoughts on this.
Yeah, I do agree.
Thanks.
I think it's due to the point that we're said in the birth question is not dictated. It's that a commentary that higher education higher education institutions that we can't disclose on behalf of the student because of confidentiality. We did that obviously actually fine and we agree with them all, but then it places a lot of the vulnerability on the learners to disclose themselves and to know what job they need, and that's, yeah, I'm all for being independent and they know themselves like anyone else. However, that isn't all but a responsibility to place on a learner that have probably never been in person before and don't know what they need. I'm gonna clear it. You can't just walk into a appointment that day and know what you need and not clinical testing. You need it being that beforehand. Do we get better learning to kind of discover what they need on the first day? Well, how are they gonna know? Some of them are 18 and never had a job before. Never mind worked in a house before. so much responsibility. And if you're only done on a ball or 6-week placement, then it's very unlikely that they're going to have figured out everything that they need in that short time frame. And it's annoying. Of course, they only want to get as many documents as they can and get it right in that time frame and that job. Of course they do. But the reality is that they're not going to get it right because it's just the short time frame to get that right. And I'm not saying we shouldn't achieve and try to get that right because we are doing a job, but we need to stop putting that pressure on learners and our adults to get it perfect because the reality is that we just can't. Can we mark a learner down for not doing note taking, they need dragon, and that not being dealt up on by? And no, we can't. That's not very there. Therefore, we need to work together collaboratively with learners to either get them the individual that they need or think of other ways that we can get around it. So even if we can't get that busy-week adjustment in place for that 6 weeks, we can do something because something is better than nothing. Stop sharing now. Thank
Thanks,
you.
Georgia. George, I was going to say, if you want to keep sharing, because I thought while we were on you, you'd almost answered kind of part of what I was going to ask you about how we promote inclusive learning environments. But actually, you're using a great example there, which was I was also going to follow up and ask about the role that innovation and digital tools, flexible learning models can play. So it'd be really useful as we use digital tools to kind of facilitate, just to think about, are there some opportunities there as well? And it'd be interesting as what you've seen, particularly I think even over the last couple of years, how things have changed so quickly. And I anticipate in a couple of years' time there'll be even further kind of innovation that we can look to embrace.
Yeah, definitely. In digital tools, I use these as the lecturer, the teacher. So we all need digital tools, no matter who we are, to help us at the support we need. Playing catching is a really big one for me. So we all went and had to do the training at work, and it was kind of like you need to put catching on your lectures, and it was like, well, cool, we do, but catching don't pick me up. So this is why I got voiced it recognising non-standard speech. I know it's not perfect, but it's really good for me. Oh, it didn't even pick me up there. Having voiced it pick me up is amazing. But yeah, I think online tools can be very well, like helping bring engagement for that anonymous feedback from learners as well. For example, the learners that are not confident to speak up in the classroom or things like that. Online tools can help with that anonymous feedback, and it can be really valuable. I think well. But when it comes to placements, going against the 9-to-5 standards as well, like why do it better students to be on placement 9-to-5 or 8-to-4? We've all been students at one time. We all know how mentally and physically exhausting being on placement is. Having that is really great and having that opportunity. If a student work better in the afternoon, then let a student work in the afternoon in the evening, rather than making them community because obviously we understand that practice can't just be like that all the time, but always practice reinforcing that more than what we need to. Again, going back to in the classroom, using games to do different members of teaching, and breaking up the teaching a bit just and that doesn't like to do need to be like an hour long. and they do need to be kind of doing like that, and that's kind of what it is. We can't get around that, but not everyone actually doesn't need to be like that. They're thinking about breaking it up. I personally love a debate in the classroom. I think it really gets the students going, because you get the I'm passionate about a topic we don't want today, then they really come to the front and be like, we had one student recently that was on picked a died completely on their own. No one else was on their died. And this wasn't a confident student because no one else was on their died. She went for it because she was standing up for what she believed in. So yeah, breaking it up, thinking about potentially different ways of working, some don't want to integrate, some do, some just kind of go with the flow, and then we you mix it up a bit more. Obviously, I know the easy said than done, and we all kind of had these ideas, and then we all to come, and we don't have time to implement them and them, but just being more actively aware of actually I'm doing a VR actor. It's going to be boring. How can we make it more engaging and more inclusive? We are there at my university over online lecture catch recording. So the actual lecture is always recorded. They miss that. They can catch up with that online as well. Thank you.
Roger. Adrian, I just thought you kind of touched on this a bit, about obviously the role of regulators and the work that you've been doing around reasonable adjustments. But it'd be interesting to hear kind of more on that. But particularly, I think part of the issue that members might face is trying to understand what the overall picture is. So they might be hearing potentially competing messages, or it might seem that way, from different regulators, from professional bodies and others. Is there work that can be done for further collaboration, just to ensure that everyone knows they're on the same page and to avoid any potential confusion?
Yeah, thanks, James. And yeah, I mean, the straightforward answer to your question is yes, absolutely. That approach of recognizing that every single one of those organizations has a role to play in supporting disabled learners, and I think that's important to see that as distinct from the importance of having organizations that understand how to approach the issue of reasonable adjustment. So, we're keen to and absolutely recognize and want to do more around, for example, the developing of guidance that we're keen to do about, we can explain more about what the careers are that we regulate under the Health and Care Professions Council, what's involved in those, what some of those issues might be, the way you might be expected to work, some of the ways in which people have practiced with disabilities and the support they've been able to access, and where there have been gaps and how those have been kind of imaginatively, innovatively explored. We can absolutely, and kind of keen to do more of that. The role of professional bodies in actually being really supportive of their members, and I know an awful lot of them already are as advocates for disabled practitioners who can kind of demonstrate the importance of rewarding active careers people can practice perfectly safely and effectively regardless of disability. I suppose one of the things that we're particularly from a regulatory role, we will often be asked that question. And I can see I haven't gone into the Q&A, but I can even see in the chat, what is reasonable? And that's probably the question we probably get asked most frequently in our inbox, and it's probably the question that we cannot answer. But that doesn't mean that it's a useless conversation. People obviously want to know what is reasonable, and reasonable is not defined within the Equality Act, which I appreciate leaves open an awful lot. But there is a huge amount of guidance available by engaging with the principles of the Equality Act. So there's some just really good starting points, but it can help understand what is not reasonable. So, for example, in making alterations to competence standards and thresholds, we can recognise that as not reasonable, but it's very clear that making adjustments to the method of assessment is reasonable. That is a reasonable thing to adjust, and then you can work your way through work your way through some really helpful guidance on the Equality Human Rights Commission website around the kind of factors that will help you determine whether or not it's reasonable, how practical, how easy it is. I also think there's more. We'd like to see more focus, and again, be involved in this conversation on recognizing that reasonable adjustments are agreed. They aren't, I don't come telling you what a reasonable adjustment is, and an HEI doesn't get to tell me what a reasonable adjustment is. They are agreed, they're worked through, to make sure that people understand that it's got to be effective, but it's also got to be deliverable. People having a lot more confidence as well around navigating this, so there will inevitably be some tough messages to deliver, and some really difficult decisions to make, and that doesn't mean that they shouldn't be made, but the fact that what was reasonable last year may not be reasonable next year because, for example, finances might have changed. But the flip side is what was unreasonable last year may well have become reasonable this year. And Georgia gave some really good examples there of how technology and innovation is improving to create all these new opportunities where something perhaps wasn't possible previously. So it does need that continual ongoing engagement with knowledgeable, experienced, driven people who can kind of take responsibility for that. And HCPC has a responsibility within that conversation as well. I want to make it clear, I'm not pushing that out. That is something that we want to be doing as well. I think there was another point to the question that I was going to make. Which just being, whilst it's not a question that we can always answer, when we do get those, can you tell me if this particular adjustment will be reasonable? It doesn't mean we're not interested in those questions, emails coming into us anyway, because it really helps us understand the challenges that people are having, and it helps us, for example, develop the next piece of guidance or the next answer to the question that we'd like to be giving. So I don't want to deter people from coming to us. Maybe with acknowledgement, we may not be able to give you that answer that says yes, reasonable, no, not reasonable, but we certainly are interested in kind of helping you explore how you might want to approach considering that question for yourself.
Adrian, and I think that's a really useful point, hopefully, for members about the complexity in terms of the dynamism of it, that things can change. Because I'm conscious that sometimes what we've heard when we've engaged members has been that perhaps one adjustment might be reasonable in isolation, but actually, if that gets expanded out to a whole cohort, it's much harder for a university to deliver, particularly with challenges as they are. With finances, but even literally sometimes space when it comes to, for example, isolation, when it comes to certain testing and things like that. If you run out of rooms, it's very difficult to do that. So I think that's a really good point, that what might not work one year could work another, but vice versa as well. So thanks so much for that, Adrian. And I think, again, really nice to kind of just echo that even if there aren't straightforward answers to that, it doesn't mean that it's that we kind of sidestep the conversation, because I think we do need to keep our regulators involved in these conversations, just so that we can make sure that the student experience, the courses, and obviously the professions themselves are sustainable. Raluca, have you got any thoughts on that question?
Just a couple of points. The one around the regulators also working together, isn't it? As I'm mindful, obviously, higher education will provide a variety of courses, and so it's quite tricky to sort of probably have to go from one set of rules, expectations, definitions, and so on and so forth, as general as they can be, to another one, and try and set different expectations for different cohorts or different professions. So perhaps that idea of working together and coming with shared expectations in a way. But to the point of reasonable needs to be proportionate and sustainable. What we also found within the National Trust report in December was that some adjustments that were made in education, they weren't mirrored in early employment, and then that really mismatch between not being able to be mirrored led to a lot of early attrition as well. So those adjustments coming from a practice environment and sort of working environment perspective, they really need to be aligned, to be realistic for practice, isn't it? Not just for placement. And I think, as Adrian said, there will be some tough conversations, I'm sure. It's just keeping those, both the expectations, but also the realistic side of it I think is really, really important. And another really strong point that came through, and I remember reading that quite a few times from the reasonable adjustments workshop, was around safety. And there was a conversation about, how are all of this reasonable adjustments being upheld, but actually, safety being upheld. And actually it was turned on its head. And they were saying it wasn't really about upholding the reasonable adjustments makes it unsafe for patients, but actually not upholding it can make it unsafe for patients. Because you can then have students within practice environment that are not perhaps able to use the digital systems that there are, or the papers that we print on, the handovers, and so on and so forth, for a variety of reasons. And actually that puts the patient at risk. And so it's actually when those reasonable adjustments, or some of them, that are not met, it can lead to patients being put at risk. So it was an interesting one. They were talking about examples of struggling with unfamiliar digital systems, unsafe travel from early to sort of very late shifts as well, or working through unmanaged health needs because of that fear of being judged. So a very different way of looking at it when we come to patient safety and rotas and stretched workforce already.
Thanks, Raluca. I had a couple of other questions, but I'm conscious that we've got loads of questions from our members. So I thought what I'd do is maybe just put a few of them together where I can, and just see, because some of them are targeted as well at kind of individuals on the panel. So bear with me as I try and race through some of them and hopefully do them justice. So the first question that was kind of put and upvoted was related to Adrian, and it said, your point is really important. And I think this relates back to the beginning of the conversation that we had about the challenge when it came to education setting, saying, well, you won't get this in practice, and actually, as you kind of set out, that we shouldn't be kind of planning around hypotheticals. We've got to plan about what the actual reality of the education setting, but practice placements are as well. So so the question was about that. So reluctance to make those accommodations because, inverted commas, you won't get this when you were working. What can we do to change this? So again, that's probably something for all of the panel. Just thoughts on how we can change that as well. And we've got a few other points here, and then maybe I'll try and do three at a time. So another one which says, some of these are kind of more comments, but again, it's really useful to have this experience shared. So someone said, I put in place all reasonable adjustment plans for students at my university. An issue that I'm coming across is the support in place for a first-year student versus that student now being a third year and still relying heavily on the reasonable adjustments, whereby they should hopefully have been used as a scaffold, but are more of an enabler. And whether it sets unrealistic expectations on or for the student as to how they can be supported as a registrant. This is potentially more around travel and anxiety as opposed to long-term physical health conditions. Though actually I could see how that could expand out as well. So I suppose it relates to that first question, and it almost relates to kind of what you were saying, Adrian, but perhaps in a more positive way, which is hopefully supporting students in a way that allows them to kind of flourish. And I suppose concern that reasonable adjustments sometimes could kind of pen someone in a little bit and perhaps give unrealistic expectations. Be interesting to hear your thoughts, but then maybe Georgia and Raluca, if you have any thoughts about those first two, because they felt quite linked.
Yeah, thank you. I mean, there is a I feel like a boring but important technical answer, which is just around what the law says. So, what can you do to persuade people is, first of all, remind them what the law says, that deciding that you won't make a reasonable adjustment because they might not get at some point in the future means you're unlawfully denying a reasonable adjustment. So there is that, and I mean, we're not here to police the Equality Act, but that's kind of, if you like, a note of warning. But I do also recognise that that question, you won't get this in practice. That can come from two angles. It can come from the negative one, where I don't want to do it, so I'm going to find a reason to not do it. But it can also be out of a genuine concern for that individual and making sure they're not being set up to fail, and they're not being set up for a future career where they might otherwise struggle. And I think it highlights the importance of that, what I referenced early on about your determination to build a trust a high trust environment where you can have open and honest conversations, where you can explore with a disabled learner what their career aspirations are. So they've got a realistic understanding about what it is they would like to do with the qualification they're working their way through at that moment. And you can explore with them then, this is the way that people ordinarily practice. Let's think about how you might be able to practice if there's a particular reason why that might be otherwise challenging, but also do you have a realistic expectation of being able to do this? Working in a single-handed practice, whatever, that might be very difficult with a particular condition, but it might be something where someone has a very clear plan about how they're going to manage that in their future life. And actually, the reasonable adjustments they need are just to achieve that qualification, and they will be perfectly capable of practicing safely and effectively. So I think it's not going to be easy to persuade others, and I saw there was a linked question as well about perhaps the HEI is the one who's really keen to do it, and it's maybe the practice setting is the one that struggles, and that I think that high trust environment needs to kind of extend into the relationship between HEIs and those practice settings, and again being really clear about who has that responsibility to support that disabled learner.
Thanks, Adrian. And this is something which we hear back actually from some of our partners in practice settings, and the kind of the NHS bodies that we work with as well, which is concern from their side about reasonable adjustments and the extent to which, again, to use your phrase, that people might be set up to fail. So I suppose it is that really difficult balance to sometimes strike, and of course, the answer that we always have as the council is closer join up. It's just that it's always harder to do than it is to say. We continually call for closer join up between education and health across settings and across government and across regulators. And I think we get there between all of us on some of these steps, but we know that there is much more to do. Georgia, I don't know if you had any thoughts about those questions.
Yeah, I did have a few thoughts. And getting my green up again.
Yeah, go for it.
Yeah, I'm 100% agree with Adrian's point. That we do different jobs be put into place no matter what they're doing. However, I would argue that didn't rise any more in their placement than at work, because when they are at work, when doing at work, you pick where you want to work. You pick how far it is from where you live. You pick whether you're interested in that area or not. But the employment, you don't have that control. So whether you need more new adjustment or not isn't the question, because they are probably going to need more employment because they don't have remote control over that as well. And then with regard to the second question, I think it comes down to disclosure, and then that pointed out that the we need is not the game is not more different in the third year. And I think yes, and I think if anything that the design is gone well, because due to the being comfortable enough today, I need this, isn't it? So I think due to trying to do more adjustment to the bigger to the car, it's actually a good time. And it goes back to that positive environment that we need to make to enjoy the learning via day-to-day growth, the disability. We often advertise that disclose, we often advert like, oh, you disclose, like, you get arguing the adjustment, and it's like, come on, disclose, but do we actually recognize that disclose is hard-born, and with an area, and do we actually do it? I know that it's really hard. I know that the HDR about no more and there. I know that you did go previously an appointment and it didn't go to plan, and that was rubbish. What do you want them to do next time so that it don't go to plan and so that it don't work out? And it do recognizing that it is hard, and Bethany someone got an invisible to do that, and they got a baby not be worried, or had a bad experience recording in the past. Like, there's so much fear that comes with that, and it's about us recognising that and saying, look, I know this is rubbish, but what can we do to help you with that? And what are your strengths? How can we play on your strengths on placement? We also need to understand the strengths based support about the environment. What might you need? Exactly. They're not reading that before we said earlier, they're not going to know what they need. What might you need? What is the strength of yours? How can we put your strength for placement? And is it collaborative purchase as well? And I think we often think the closure and the tick box that happened on the first day of placement, but it doesn't. The closure happens continuously because disability portrait and it's not the same every day. So I don't think we can do well. They need more renewable adjustment in the areas in the area because they might do, because that area could be more challenging for them and their disability. So we need to be honest about that. We need to be having continuous diffusion in the continuous conversation. It needs to be in the diffusion agenda every single week. We put the adjustment in last week. How's that doing? Or what you find it, you know what? That goes wrong. That's actually a good sign because it means the learning couldn't do enough to tell you that it gone wrong and to change it, right? So it's not comfortable to have the open conversation and you think it's all gone to plan. It may not come to plan. So there's a lot to kind of unpack there, and we all have a role in facilitating accommodation and making sure a learner is supported to grow their disability in a trend way, but also get the need get met and they can have the continued accommodation. Actually this is not working. Can we try something else?
Thanks, Georgia. And Raluca, we kind of touched on that there, that George kind of started to lean into something else which has come up in the questions, which is about disclosure. And again, I don't know if any of your work has kind of looked at what are there kind of models of best practice, or what do we do when it comes to our members actually trying to make it as easy as possible for that disclosure, but also to sometimes work with the challenge when actually something isn't disclosed, which maybe it would have been much easier had that had been done earlier as well.
That's interesting because one of the themes that I wrote down was that disclosure anxiety, and that fatigue, having to repeat and sometimes not working out. I can't speak to sort of best case scenarios. I don't think we've included those in the report, but I think it's a bit of a summary of what it's been said, isn't it? Is that joint conversations between HEIs and practice learning environments where the student, it's not back to what Georgia was saying, it's not on the student to disclose every time to every single placement environment. But what we have heard that can work is normalizing it. And I think it's much to the first question that you posed. It's normalizing those conversations right at the beginning. We're looking at placements. Is there anything we need to be aware of, but similar in the placement, because I know there's that discrepancy between the HEIs and the placement providers, and those plans not being carried forward. So that joint working, I'm on that page for sure, and all of the evidence that we have suggests that that would be very supportive, but also normalizing it in all of the conversations and getting staff. I guess that's the other side of it, isn't it? What we've heard is that staff often feel uncomfortable and unsure. I mean, the system is quite difficult to navigate, much to Adrian's point that we can't give a straight answer what's a reasonable adjustment. So it's no surprise that staff feel sometimes uncomfortable knowing whether to accept or how to deal with one of those requests. And so having that and supporting them through a systemic or systematic a way, that's perhaps one of the things that can help. And there are some little things, because we have heard, we know how great digital is and that we're going towards that, but we also know that brings and throws in so many challenges, especially when it comes to reasonable adjustments. So what some of the things, and that was one of the big challenge that came through the reasonable adjustment workshop. And one of the things was quite a lot around, do we have a practice environment that we can, a sandpit of this system, so we're not thrown in the deep end, not really knowing, or do we have that booklet about the placement environment so we can prepare ourselves in advance? And I guess anxiety, not knowing where you're going into feeds into that, and that some of the solutions are quite practical. Some of them are obviously systemic, but some of them can be quite practical.
I'm conscious that we are running out of time and there's so many questions, so I'm going to try and hopefully do them justice. Apologies to participants if I don't, but I'm conscious that the recurring theme that seems to come up is, we've touched on it slightly, which is the difference between settings, between sectors as well. So even in an education stage of someone's professional development, for want of a better term, there might be differences between what a university deems a reasonable adjustment and what the placement setting deems a reasonable adjustment. It'd be really interesting to explore that a little bit and to see what happens when that doesn't match up. And again, someone else raised a point which isn't atypical from what I've heard from members, that there might be occupational kind of health approach across a university, but it's very kind of top line. It's about being a student at the university. It doesn't take into consideration healthcare courses and obviously the demands that come on them with placement settings. So it would be interesting to hear about that. Linked to that, there is again, it's about kind of where that responsibility sometimes lies, because there was another question about when it comes to assisted technology, but it could also be for other reasonable adjustments. Where does responsibility lie for making those available for students in practice settings? And it'd be interesting to hear if there are some thoughts on that as well. And then I suppose just quickly scrolling down so I can try and get as many as we can, and then we'll probably try and close as well, just to make sure that we do get everything included there. I suppose we do come back time and again to that question about kind of what's reasonable and what's not. And I suppose part of that question said, in the spirit of this conversation, is I suppose what advice is there for members when a reasonable adjustment can't or shouldn't be met? And it'd be really interesting to hear that. I know that the focus of this has been how we make sure that they're equipped to offer them where they can, where they're needed. But actually, obviously, I think probably underlying lots of the questions from our members will be this anxiety about when they look at something and a situation and they don't feel that that's appropriate, or they don't feel that they're able to. Is there advice in terms of how to approach that you might be able to offer too? So I thought what we'll do is we'll go to Georgia, then Adrian, then Raluca, and then bring it to a close. But I know that we could go on for hours and hours, so I promise that we won't, because I think we might already run over slightly, but I do promise that participants, this isn't going away as a topic, and we will be exploring this further at online and in-person events as well. So Georgia, just some thoughts from you, those questions about the different settings, and also that challenge sometimes of how can we equip them to sometimes have to be able to say no, and what does that look like? What's a good way of doing that, hard as this is and difficult it is as a question?
So you're ending it on a really hard question.
Yeah,
Thank
sorry,
you for
I've
that.
just left like the hardest bit to last. Apologies,
Yeah.
Georgia.
So I think it's about the HTI and to answer the main question, the HTI and the perfect partner working in partnership. No, I don't think we can say one person could offer that and one person couldn't. I understand the different parties and different regulating in the environment, but what we encourage students to do is kind of have a plan of what adjustment they needed, and then they can take that forward to future placement involved. I think obviously that really challenging between the different environment, because we're encouraging students to have the open documents and then we might the other went really well on one person, but another person not offering it. So I think that's definitely part of why the conversation to be had, because I don't personally think it's fair when a student have found what worked well for them on one person and then another person fact then we can't offer that. And then everything that feeds into the last question, which where do we begin? I don't even know what to say. I've never come across a student asking for something that isn't reasonable in my years in this job, and like you said, I'm also a family member with DK, so we speak to the disabled students all the time at our support groups, and I never come across that. So I think that's really interesting. Speak about being open and honest and saying perhaps we can't provide that because you only hear this long, but we can do that. I think there needs to be a reason, not just we can't provide that because you don't need that. How do you know they don't need that? How do you know they're being truthful or not when you just met the student a week ago on placement? You cannot make that judgment. So I think it needs to be need to come from a good place. We can't provide that because that's going to take you too long to set up, and we want you to get the most out of the place. But what we can do is there, or what I can have before that tomorrow that perhaps we can mirror. I heard that helpful. I don't think it is, but I think it's a
So much, and it was unfair of me. That question probably could have been a whole seminar, to be honest. But just quickly, I know there'll be a feedback poll that's coming up now for people who are participating. I think we can carry on for a few more minutes on this, just to kind of close this. And there was a good answer from someone that's one of our participants who's actually also said there've only been a couple of occasions that they've experienced that challenge of not meeting the adjustments, but they've involved the student throughout, being really open and honest with that, which is what I think what you were kind of talking about there, Georgia, as well. But again, Adrian, if we go over to you just for your final thoughts on that, those settings, challenges, and that horrible final question that I posed, and then over to Raluca, and then we'll bring it to a close. Thanks everyone for bearing.
Yeah, I will be really quick. When there's disagreement, I suppose it's important that your approach doesn't separate off disability from any other kind of consideration that you might have. Like, who's responsible for keeping learners safe in a practice setting? You know, who's responsible for maintaining the safety of learners? So, you know, when there's already approaches that people use for considering who is responsible for safety for making decisions about individuals and involving them in decisions. I think some of those conversations in the chat have been absolutely important. Like it's going to involve an enhanced level of collaboration and probably a better degree of relationship between practice settings and HEIs, you know, and far clearer lines of communication. I did say very quick, and as you said, I can go on for longer about that, but yeah, having that real kind of clarity, and also make sure that people do know why they're making that decision as well, that people aren't making what they believe to be good decisions for the wrong reasons, you know, so that they actually, you know, that they aren't gatekeeping or safeguarding an imaginary something else, you know, that there is something different going on there. What the answer to your last question is you know, what about when, you know, it's either not possible, it might not be achievable. I suppose my big advice is make good decisions. So, you know, that you've got really clear rationale, because you can ultimately conclude that something that someone has asked for is not reasonable to provide. So make a good quality decision in that case, really work it through, provide some rationale, involve the person in that decision and explain it clearly to them.
Great, thank you, Adrian. Concise and a very good answer to a horrible question. And Raluca.
I echo what was said, and I'm not going to give you a straight answer, just I'm sure you're used to those. What I will say is that consistency and transparency, as far as obviously it's within your power, but I do think that there is an opportunity. You know, you have got the NMC looking at that as a key line of inquiry. There are open communications, and I think Adrian also mentioned about review within HCPC. So there are those avenues to start asking more questions, or to repeat the questions, because I think sometimes you probably ask them quite a few times, but that conversation seems to be open. So continue that whilst those reviews and those, you know, the focus is on it, and hopefully will be more clarity across the board. And hopefully, you know, in an ideal world, that joint working.
But I swear, the Council of Deans of Health, it always comes back to, can we have closer joint working between health and education? Because we know that our members are at the intersection of it, and we should have known that, of course, that ends up being the crux of so much of the challenge around reasonable adjustments as well, and making sure we get that right. So thank you so much to all of our speakers. It's been fantastic hearing from Raluca, from Adrian, from Georgia, and from all of you who've joined us. Hopefully we did justice to those questions. There were so many, but what we'll do is take note of them and continue to feed that into our policy work. And like I said, this is a conversation that will be continuing. And please do join us for the rest of Equity Month. We've got more coming up, so do head to our website to see what else you can get involved with as well. So thank you very much. It's been wonderful having you here. Thanks.